Strike actions by medical health workers is not a new phenomenon in Nigeria. In the last 1 year of President Buhari's administration alone, both the Nigerian Medical Association and members of the Joint Health Workers Union have threatened to embark on strike actions, with several ultimatums given to the government. The president of the Joint Health Workers Union is blaming both the federal government and the Nigerian Medical Association for unequal treatment in the sector that has caused several industrial actions.
Let me tell you why the turbulence is there. Like I said, the unfair treatment. And the second part of it is because the medical doctors and the ministry that is, governed by the medical doctors, they deny us our dues. So when we now come up and say, why are you not giving us? And then we come on strike. They brand us as strike mongers. Then they go to government. You see, if we don't privatize, these strikes won't end. Let us privatize. So that when they privatize, because they have a win-win situation in privatization. If it is privatized, they buy up the hospitals. If it is not privatized and we go to work, we go on strike, their clinics, their private clinics thrive.
Meanwhile, the Nigerian Medical Association says the rivalry in the sector, which has led to several industrial actions, is uncalled for.
The interprofessional rivalry that is bringing about this harmonious relationship in the public health sector is all about sibling rivalry. Why should you be called the first son? And why should you be given the greater portion of the meat? What of me? Don't you think I'm doing more work in the family than you? That is not right. And that is what we are saying. Medicine is not indigenous to Nigeria. And we are saying go and verify. There's something called international or global best practices. And we are saying go and verify how this thing is done elsewhere. Accept what you are. Do what you are doing. Be proud of it. Answer the nurse you are. You don't need to answer consultant. Put appellation of consultant before nurse for you to be recognized.
Away from the issues of strike actions by medical workers, both the Joint Healthcare Union and the Nigerian Medical Association also differ in their suggestions on how to improve medical services in public hospitals.
If the government wants peace in the health sector and efficient service delivery, outside the infrastructure, equipment, and all that, that fair treatment should come. Right now, they are employed by government. Government pays them, does everything. And they still go out and establish their clinics and practice in their clinics. So, where will the loyalty be? We are recommending that even if for experimental purpose, 10 years, even if for 10 years, let the government, withdraw that privilege given to them.
Government as the parent should not provoke the children who are the employees. But the employees should not be unruly. Government should be able to instill discipline. We have all the laws, all the statutes, public service rules to instill discipline in workers. They are not doing that. The supervision is so poor. Inspectorate activity is almost zero. People come and do whatever they like. They commit all sorts. They go scot-free.
When the 2016 World Health Day was celebrated in April, the Minister of Health said it was an occasion for government to take stock of the nation's health sector with a view to improving service delivery. Indeed, healthcare practitioners agree that the government needs to take stock of the sector and take some deliberate but decisive actions to improve the sector.